Good evening, Molly. I really enjoy reading all of your posts, getting your perspective on the readings and things that we have done each week. And while I am sympathetic to children and adolescents who are experiencing severe depression and anxiety, I would be reserved to have them on this type of medication, the SSRIs. I had an acquaintance in college, so she was probably around 18, that did a drug trial to help her pay for college. And she stayed at their facility where they could monitor her, and it was an antidepressant of some sort. I don't think it was the SSRI, but it was an antidepressant. They found her hanging in her room. Since then, I have been very hesitant about using medication that could bring suicidal thoughts. Of course, the level of anxiety or depression needs to be evaluated by a professional. Mild to moderate depression can be managed through psychotherapy. If the clients present severe depression, it may take a combination of psychotherapy and medication. Scott, 2016. Often, children and adolescents who develop depression have an underlying condition that develops into depression. A doctor or counselor might be able to identify the underlying problem and use cognitive behavioral therapy to speak to the issue at hand and hopefully help the client to feel less depressed. If the client presents severe depression and is already at a high suicide rate, the risk of taking the medication might be worth it, and that decision needs to be in the hands of their physician and the parent of the individual. The decision on whether to use SSRIs should be up to them, the parents and the physicians, and children showing these symptoms should be closely monitored. I do believe that it was very emphasized throughout the readings about monitoring. So I do think that this is taken very seriously, whether you think that they should be on it or not. I do believe that everybody is on the same page with monitoring these individuals with these sort of thoughts. And so if the decision is made to take the SSRIs, monitoring the patient for the first 4 to 6 weeks is required. I personally would prefer to hold off until the person is older and can handle the medication better. So with the attempt of trying, the cognitive behavioral therapy and any sort of tools that can help through counseling and things like that with the individual. But as stated, if it becomes to the point where it's severe, sometimes the risk may be worth taking, and that would be completely up to the parents and the people that are closer to them and know the situation. And so I am so thankful for all that this class is adding to us and all the topics that really cause us to think. They're not always easy. It's not always a yes or no, but I'm just trying to see it from the other perspective. But thank you so much for yours, and I look forward to reading more of your posts in the future.